Hello, everyone, and welcome. On behalf of the MICTech team, I would like to thank you for joining us today. Today, we will be going over Module 10 of our Data Beyond the Tip of the Iceberg series, and we'll be hearing from Astor Services for Children and Families to talk about who are one of our outcome champions. The presenter today is going to be Dr. Daniel Korovikov, and we're going to pass it off to Chris, who's going to frame today's presentation with our data matrix.
Thank you again, Ashley. Just to orient you to where we are on the matrix, we're looking at the right-hand side of the matrix and thinking about outcomes, data outcomes. And what Daniel's going to be talking about is how Astor created program-level outcomes and created data, usable data of individual client outcomes to show the success of individual programs. So again, looking forward to this, Daniel, and thanks for the presentation. Over to you.
Thank you. My name is Daniel Korovikov. I am the Director of Analytics at Astor Services for Children and Families. I'll say it again, Astor Services is a nonprofit in the Hudson Valley and the Bronx, serving around 10,000 kids every year in a wide array of programs, which will be very relevant here. So it ranges everything from a residential program to outpatient, early childhood Head Start programs, care management. So very, very different programs, which understandably become difficult to compare side by side, but we'll try anyway. So where we're headed is something along the lines of the visuals in front of you here. All of these visuals were done using Power BI, but I do want to make it clear that this is also very doable in Excel with pivot tables. It is going to require more skill set than the fiscal modeling in Module 9, only because there's probably more data sets to work with at once. So if you have a data warehouse, it's helpful. If you don't, you'll probably need somebody very skilled with Excel and good at organizing data. And just to say where we pull our data from, it's a huge set of sources because it is 20 different programs. It's different electronic health records. It's timekeeping software. It's Excel spreadsheets where people just manually have to add things because they're small programs that run things differently. All of it gets combined together and presented in one place. So the agenda for this presentation is going to be to talk about finding a way to strike a balance between comprehensiveness and straightforwardness when it comes to outcome metrics. I will provide a case study, how Astor has built a unified outcome tracking model, and I'll provide visuals for how we go about doing so. So like the prior module, we're going to start things off by defining the idea without metrics or the logic behind it or anything like that, and then we can talk about how we would go about measuring this. And this one is a lot harder to define than productivity was. I bring this up right from the start because you'll need to meet with program staff to talk about how to define success within the program. And folks may get frustrated in this conversation because inherently you would think that it's easy to define success. We work with the clients every day. We do good work with them. Of course, I can tell you what success means. But doing the best you can day in, day out isn't actually the same thing as then trying to figure out where the line is between success and not success, between eligibility for analysis and not. And that's not inherently a obvious realization. And so folks can get a bit frustrated in this conversation, a forewarning. But that's what this is going to take, is trying to figure out how much success do we need to call something successful? Who should even be considered in the evaluation? And what I'll offer is how I've tried to do this. I have maybe not the best metaphor, but it's worked for me. Picture those little pamphlets that lots of nonprofits and agencies throughout that have those little testimonials in there and everything like that. Little Johnny, he came to us, he had all these difficulties. We did wonderful work. Look how great little Johnny is doing now. Please donate money to us. That type of thing. And so now I ask staff, how would you feel about some client being on that pamphlet? And if, when you think about that client and you think about people reading about them on that pamphlet, your first thought is, that's great, perfect. They're going to get a good picture of how well our program runs. Well, that's a successful outcome then. If they're going to go, oh, please, probably not a great idea to include them. It might be we didn't do the right thing. It might be the client outcome just didn't turn out well. But one way or another, this is not our best work. That's going to be unsuccessful, regardless of where we place the fault there. And lastly, there's just a category of, I don't understand, the kid just got admitted, or they came for an intake and then they left like a week later. I can't tell you anything about them. And those are going to be our ineligible for analysis clients. So we have our metaphor. We're looking for who should make it into our pamphlet. And now we want to have a straightforward metric. Ideally, this is some kind of universal metric. These are very popular and lots of agencies are always looking for these. And I'm not a very big fan of them because it's really difficult to marry a universal metric with one that is sufficiently comprehensive. I'll provide an example in a second. So on the one hand, we want something nice and straightforward that's comparable program to program. On the other hand, we need it to actually apply well to individual clients. If it doesn't, then what's the point? I've introduced the 90-90 rule in the prior module, but to reiterate it here, as it applies to our comprehensiveness, at least 90% of the time, if the metric says a client is doing green, then they should really be doing well. And staff should all agree that this is one of our successful clients. And 90% of the time that we're flagging them as not doing well, staff should similarly agree that there really was a problem. This wasn't the best outcome that we could hope for. So when we think about an example, we might look at satisfaction data. That's a quick go-to that people use. Satisfaction data is very useful to track, but I don't know that it's the ultimate outcome metric. So it's certainly straightforward. It's definitely comparable across programs, but it will never pass the 90-90 rule. Your staff will not agree that everybody that says they're happy had a great outcome, and anyone who has any misgivings is a unsuccessful outcome, probably. Some programs, on the other hand, agencies on the other hand, will say, well, we're giving up on the universal metric. We're going to just have individual metrics. And it's fine if you have to go there, but it really does make it difficult to compare things side by side. What do you do when your Head Start program says that 90% of their kids meet or exceed age-appropriate skills, right next to your home-based crisis program saying that, well, only 6% of our clients were hospitalized this year? You just don't know where to give your attention. So if the ultimate goal, like I mentioned in Module 9, is that people walk away with good information, making good decisions, then we really need to find a way to marry the two concepts. The way we've done it at Astor is by allowing programs to define their own criteria for what a successful client is, right? Who should be a good candidate to be listed in that pamphlet. That ensures that we have the comprehensiveness part. That ensures that 90-90 rule works. But then we want to make sure that it's still comparable across programs. And to do that, we have an annual review process that's fairly systematic and really does a pretty good job of making sure that when one program says that 92% of their clients are successful and another program says 92% of their clients are successful, that you can treat those similarly. So just two examples of where that has gone with our agency. Our partial hospitalization program says that a successful client is one that doesn't get hospitalized at all during the program or the 30 days after discharge. They are a hospital diversion program. And 90% of the clients that do that are in fact considered to be a successful client. And in our Head Start classrooms, we were saying that using the tools they already have in place, if the students meet 85% of the expectations developed in that system by the end of the year, that they've made good growth over the course of that year. Very different metrics, but in both cases, we can now compare them side by side. So before we get to the visuals, I will briefly describe what that review process is, and then we can finally get to the pretty stuff. So at the end of the year, we meet with a couple staff from each program. We offer them 10 clients that got discharged that they know of, and we say, what do you think? Should they be in the pamphlet or should they not be in the pamphlet? Based on your personal gut feeling. I'm not going to tell you exactly what your program defined if you don't happen to know it already. Just what is your feeling about this? And if the staff are rating things the same way that the metric determined it, then, well, that's great. Then we really have a pretty good, accurate reflection of what it takes to be successful. And if the staff ratings don't match what the metric is determining, then we've got one of two situations. Either the frontline staff and your supervisors have very different ideas of what the goals of the program are, or there really is a problem with the metric. It's not predicting things the way you want them to, and you make a change and you iteratively get better with each coming year. So now we can talk about what this actually ends up looking like and how you would go about using it. So at the highest level, at that agency-wide level, you might be looking at something like this in front of you. We can see how many clients are in each program or even a group of programs, and then how many of them met the criteria to be analyzable, which we'll touch on in a second, and then how many are successful in a nice color-coded way. The value of a view like this is that your eyes get drawn primarily to the areas that you, as the product designer, want them to be drawn to. So my eyes immediately get moved, look to those red numbers, the 66%, the 50%, right? Low success. And that's what I want you to focus on. And my eyes get drawn to that 16% eligibility, that 50% eligibility, those low eligibility ones. And again, those are areas that I want your eyes to be drawn to because those are the areas that are going to warrant attention. Similarly, the programs that have the most clients probably warrant more attention or scrutiny. So now let's say we looked at one of those programs and we want to drill down one level and see how things are going within the program. So we have 190 clients and 181 of them are analyzable. We know what the eligibility criteria is. It says it right there, that it's a case that is closed now, that was served in the last 12 months. And that seems fine to me. If we can speak to 95% of the clients we've served in the last year in terms of being able to analyze them, then I can feel pretty good about whatever outcome results we're about to see. Now, I bring that up to say that some programs work with their clients for a much longer time. If you use the same criteria for something like a foster care program that works with kids for years and years at a time, it could create problems where only a few of the kids got discharged this year. And then you might need to change the eligibility to say something like, we're going to look at how this year of treatment went, not how this whole episode, just this individual year. All right, so still looking at the program level, I'm just trying to offer nice zoomed in visuals for everyone here. The two criteria that this program had, the partial program we were talking about, is that you don't get discharged to a higher level of care and that you're not hospitalized now or later. And we can easily and cleanly see how well we're doing. The framework we built allows for 5 criteria at once. I don't recommend having that many at once because it makes for a mouthful of a metric that might be more complicated than it's worth, but sometimes it's needed. Lastly, looking at the program level, we can see how individual staff are doing. This seems like a drilled down version of the original agency-wide slide, and it's not that dissimilar. The added piece is that you can see how the staff are doing on individual metrics. And that's because at this level that we're talking about and thinking about it, you might need to do more to figure out why clients are succeeding or not succeeding on specific things and which staff are good or less good at specific components of the program. And you can even drill down to the individual client level here, which now I can show. This is all the way down to the individual client level. We can see how clients are doing, which makes sense because we defined our criteria based on which individual clients should or shouldn't be in the pamphlet. And we have an ability to add more information so that we can really figure out when we're sitting down at the end of the year or reviewing it as the year goes on, why certain clients did or didn't make it into the successful or the not successful bucket. So lastly, I'll just talk about how we would use this information at a level higher than the individual program view of I suppose, the executive leadership level. So not all programs need to be looked at every single month. Not all programs need performance improvement plans all the time. In the example that I'm showing here for our agency, if a program is performing above 90% of their clients are successful, then great, just keep doing whatever you're doing. No extra attention needed. Similarly, I'm just going to jump right down to D, that bottom one. It might be the lowest performing, but it's getting better every single quarter. Maybe they need more work. Their metric might be harder, but they're getting better every quarter. And that means to me that their continuous quality improvement processes, the internal ones, are working. So again, no real need to intervene. Things are going well. Now coming back up to program B, we can see that their performance dipped in July. And if your performance is dipping and you're below 90%, I'm thinking we should probably have some sort of a plan. How do we help improve our outcomes? So let's say they developed a plan, and now in October, their data has risen again. Their performance is on the upward track. Again, no extra attention needed. Things are all nicely on track with where they should be. The only one that really warrants extra attention is program C, because their performance is slipping and it keeps slipping. So you imagine they came up with a plan somewhere along the way, but the plan isn't working that great because the performance keeps slipping. This is the program that you would talk about at that executive level and not necessarily the others. So to summarize across the whole presentation here, we had to come up with a metric which you could compare across many different programs so that we could ultimately have a view like this, and yet also be a metric that works well down to the individual client level that is accurate in predicting how clients are doing, so that we could have a view similar to the prior slide with individual clients. You don't want to show staff a graph about individual clients where they just laugh about the outcomes you're presenting and say, no, none of this matches how we feel the clients are really doing. At Astor, we did this by combining all the two concepts together and saying programs can define their own metrics within a structured system that has annual ongoing review, and iteratively the metrics get better and better. And finally, we came up with a fairly standard dashboard that just drills down level by level from agency level to program level to staff, all the way down to the individual client level. And with that, I will pass it back to you, Ashley.
Thank you so much. So our next module, module 11, is going to continue the conversation about outcomes, and we will hear from ICL, who's going to talk about health outcomes at one of their programs. As always, if you have any questions, you can please email us at the email address listed on the screen, which is mictac.info@nyu.edu. If you have any specific questions for Daniel about anything that he presented today, you could also email us at the MCTAC email address, and we will pass along that info to him. Thank you again, Daniel, and thank you so much to everyone for joining today. Have a good day. Bye.